So as we move now into joint play, I'm going to move from the proximal joints to the distal joints, which means I'm starting in the talo-crural joint. Remember, the talo-crural joint is responsible for plantar and dorsiflexion. That's the osteokinematic movements. If we go into the arthrokinematic movements, we're going to be trying to restore roll and glide. In particular, I'm going to focus on glide. So the techniques I perform are going to be posterior glide and anterior glide of the talo-crural joint. So to do so, we need to stand on the same side of the table of the ankle in which we're working on. So in this case, I'm going to shift the foot I've been working on and work on this one. Let's just bring that over the side of the table. So the talo-crural joint, of course, is in between the talus and the tibia and fibula, particularly the tibia. Now I know that location because I've got the medial malleolus and the lateral malleolus, so I'm going to take the web in between my index finger and my thumb, and I'm going to move it just so my thumb is on the top of the lateral malleolus and my index finger is on the top of the medial malleolus, and that's going to put me very, very close to the bottom part or the inferior aspect of the tibia. Now my other hand is going to go right beside it, as close together as I can get those two hands. I want them very precisely close together. Now my top hand is going to stabilize and my bottom hand is going to do the movement. I'm first going to be working on posterior translation or posterior glide, essentially trying to move the talus posterior in relation to the tibia. So with this top hand quite firm, I'll take this bottom hand and I'm going to push posterior with my bottom hand. Now if you look at my body mechanics, I'm stacked. My joints are stacked, my whole body is stacked. And I start to do posterior glide. Now as I do this movement to posterior glide, what you might notice is that knee is going to a little bit of flexion. So to fix that, I'll just get you to move up on the table just a little bit more, move up that way, good. And I just want that heel, that calcaneus, just over top or just below the bottom of the edge of the table, and this will let me get a little bit more stability in the proximal portion. Remember, in one of the rules of joint play is we stabilize the proximal part and we move the distal aspect of the joint. So again, top hand stabilizing, bottom hand getting very close, nice firm grip, and I'm going to push with that bottom hand directly posterior. Now another key is the position of the ankle. It needs to be in a very relaxed, loose position, which just so happens to be about 30 degrees. We get that ankle nice and loose and relaxed. We don't want it pointed and we definitely don't want it into dorsiflexion. Nice, relaxed, and we get that posterior glide. Now I'm going to do that rhythm. I might do this 10, 20 times. And as you can see, this I'm holding down here just so you can see. As you can see, the ankle's actually moving quite freely. Some people, it doesn't move at all. You don't get a millimeter until you move through posterior glide 15, 20 times. And then it will start to shift a little bit. Now, once I've done posterior glide with this exact same hand position, I'm going to do anterior glide as best as I can. For anterior glide, I'm going to pull up. So with this bottom hand, I'm pulling up. This top hand is staying in position. It's staying stable. So I pull up, I pull up. Now, the reason I'm not going down, up, down, up, down, up is because with joint play, we try and restore one movement at a time. In this case, I'm trying to restore posterior glide. Once I've done that, I'll try and restore anterior glide to pull up. Now another way that we can restore anterior glide is by getting our client to flip face down. All right, so now that my client has flipped into a face down position, I'm going to work on the exact same ankle. So we'll shift into this ankle. And I do oftentimes get my client to bring this leg up so it's out of the way. You can stand on the outside of the table or the inside, whatever you find more comfortable. And the same thing, I'm going to use my top hand to stabilize. The same thing. Index finger is going to be on the lateral malleolus. Thumb is going to be on the medial malleolus. In this case, I'm going to use the calcaneus as my leverage point or my contact point, and I'm going to be pushing the calcaneus anterior because, of course, based on our anatomy, we know the calcaneus is pushing into the talus in this position. So I'm going to put my hands in the exact same position that I did before, right? Those hands are right beside each other, stabilizing that proximal part of the joint. And I use my body weight and I push anterior. So this is anterior glide of the talo-crural joint. So push, and then I can get a rhythm going. I might do a little bit faster of a rhythm. And I'm just moving into that joint resistance, right? So if I slow this down, I push anterior with this bottom hand until I meet that tissue resistance, and I just barely go beyond it. I'm really trying to move into that tissue resistance and just beyond it. But again, I'm not using a lot of force. We're not doing any thrusting. We're not trying to do a chiropractic adjustment or any type of manipulation. This is more of a mobilization. So this is anterior glide of the talo-crural joint. I'd like to introduce our sponsor, Jane, a clinic management software and EMR. Now, the team at Jane understands that clocking out from the clinic, well, it doesn't always mean you're clocking out for the day. Instead, it's often the start of charting long into the evening. So with time-saving charting features like custom smart narratives, chart duplication, and dictation, Jane helps you finish charting your patient's notes during work hours, not after hours. And to save you even more time, you have access to Jane's chart template library that's fully stocked with pre-made templates that have been generously shared by practitioners in the community. You can even customize them further with charting tools like side-by-side photos, checkboxes, and range scales. To see how Jane can help you free up your evenings from admin tasks, click the link in the show notes and book a personalized demo. But if you're ready to get started, you can use the code AIM1MO at the time of sign up for 1 month grace period applied to your new Jane account. So let's do one more on the talo-crural joint. Now this one's quite complicated. We're going to be applying traction at the same time as performing posterior glide of the talus in relation to the tibia. So moving to the bottom of the table, my outside hand is going to grip around the calcaneus and my top hand is going to grip around the dorsal surface of the ankle. Now you'll notice I'm getting nice and low. The first thing I want to do is make sure that ankle is in a neutral position, not dorsiflex or plantar flex. I really want it relaxed. I apply traction, so I lean back, and once I've leaned back, I'm going to use the hypothenar or the ulnar side of my hand to push that talus posteriorly, while simultaneously I'm going to use the hand gripping the calcaneus to pull the calcaneus posteriorly. So I apply traction, and then you'll see I do a little bit of dorsiflexion because I want to find that loose pack position, and then I push back with my top hand, I pull back with my bottom hand. Now, this technique gets more movement than just about any other form of joint play I've done. And I just did it 3 or 4 times, but I might do it 15 times, 20 times. I might do 3 or 4 rounds of 20 of these posterior glides, really trying to get that ankle mobilized posteriorly. And after I've done so, I'll do some gentle movement, wiggle that ankle around, because it can be very painful for some people as we shift that ankle. So again, traction, top hand pushing posterior, bottom hand pulling posterior, and then relax, traction the whole time as we go through this motion. Excellent. And again, that's doing the subtalar joint, and an incredibly effective technique at the subtalar joint.